My name is Ruben Restrepo. I'm a physician and respiratory therapist, and I'm a professor of respiratory care at the University of Texas Health Science Center, San Antonio. I believe that capnography should be the fifth vital sign and a very nice and shared position with pulse oximetry. When you actually monitor oxygenation and ventilation at once, it gives you a better indication of the respiratory function versus thinking that you're going to translate or transfer information from ventilation monitoring to oxygenation and vice versa. Having the, let's say, both parameters, oxygenation and ventilation, gives me, of course, as a clinician, a better perspective of what's going on with the patient. The one is that allows the clinician to combine everything together. If you have this in one particular device, it will just minimize the work of just having to deal with two separate devices. So I think the combination is probably the best that you can get of the two worlds that we typically manage these days, which is, again, ventilation and oxygenation. I think the places where I believe capnography needs to be used is any patient who, again, typically is at risk for any type of degree of alveolar hyperventilation. So again, if it is because they have an underlying respiratory disease or any condition that could compromise respiratory function, I think they should have capnography on board. If you make it to the ICU and you're using any type of ventilation, non-invasive pulse pressure ventilation or invasive, you should be on capnography. So as an educator, I'm in charge of making sure that all my students from RT to the physician role, they understand the importance of capnography. It is imperative that we follow the guidelines because I think it is very clear that the clinical and financial impact of not being able to detect, for example, respiratory depression is extremely important. And in fact, the Joint Commission has been very clear on making sure that both pulse oximetry and capnography can be used together.